Hi guys, welcome to my YouTube channel. I go by the name Dr. Achievement. Today my topic is coronary artery disease, CAD, or coronary heart disease. Coronary artery disease, as the name may suggest, it develops when the coronary arteries becomes too narrow or cholesterol blockage develops in the walls. The coronary arteries are the blood vessels that supply oxygen and blood to the heart. CAD tends to develop when cholesterol builds up on the arteries walls, creating plaques. This plaques causes the arteries to narrow, reducing blood flow to the heart, or can cause inflammation in and hardening of the walls of the blood vessels. A clot can sometimes obstruct blood flow, causing serious health problems. Coronary arteries form the network of blood vessels on the surface of the heart that feeds it oxygen. If these arteries narrow, the heart may not receive enough oxygen-rich blood, especially during physical activities. Causes: CAD develop as a result of injury or damage to the inner layer of the coronary artery. These damages causes fatty deposits of plaque to build up at the injury site. This deposit consists of cholesterol and other inflammatory products from cells. This buildup is called arteriosclerosis. If piece of plaque break off or rupture, platelets will cluster in the area in an attempt to repair the blood vessels. This cluster can block the artery and reduce or block blood flow, which may lead to a heart attack. You can appreciate here, guys, you can appreciate this is the heart. All right, so here is the artery supplying oxygen to the muscles of the heart. You can appreciate this is the artery. All right, this is the artery. All right, so now if there is any inflammation or any problems under the artery, or you can appreciate these issues here, then it will warrant the police officers of our body, which include the white blood cell, the platelet, and the rest, to come and cause healings in this area. So if the healings is taking place, it will cause something called inflammation or swelling. Signs of inflammations will be there. We know pains, we know swellings, especially in upper body of our skin. There will be swellings if you have a cut. All right, so now these inflammations will obstruct the blood flow coming down to this area, causing less blood supply to the muscles of the heart. The muscles of the heart is getting less blood supply, the oxygen, the nutrition, and it will affect the muscle capacity to function properly, leading to the heart attack. Let's proceed. You can appreciate this picture of the heart. You can appreciate how the arteries and the vein is circulating in this area. They are circulating. This is taking the blood back. This is supplying the blood to the heart. So now if it functions like this, then the muscles of the heart not functioning, then the heart can't not do its function, because it relies on the muscles to function properly. Symptoms, there's a lot of symptoms, but the few which I picked, there will be angina pain. You'll be feeling pains in the heart. You'll be feeling squeezing, pressure, heaviness, tightness, burning, itching around the chest. Alright. Risk factors, what could cause this, which we are doing, we don't know, that can lead to this CAD. If you have a blood pressure, high or hypertension, high level of low density lipoprotein or bad cholesterol, low level of high density lipoprotein or good cholesterol, having diabetes in which the body cannot effectively remove sugar from the bloodstream, having obesity, smoking, which increases inflammation and increases cholesterol deposits in the coronary arteries. Diagnosis. A doctor can perform lots of tests. My diagnoses are too many, so I'll just make it short. Electrocardiogram is there, Holter monitor is there, echocardiogram is there, stress test is there. All right, coronary catheterization is there, CT scans, nuclear ventriculography, blood test. A lot of diagnoses are there. I just made it short. So now to my favorite part, exercise for CAD. CAD patients should not go and do heavy exercise due to the angina pain, and you should not want to stress yourself so much because the heart is having an issue. In the medical treatment, you should consider consulting your doctor, because your doctor will give you very good advice in medicines you should take. That is fine, all right, but you should not miss exercise. Exercise would help improve too. I did not bring the medicine because I don't want to talk about medicines. I just want to talk about exercise. So what exercise can you do? Aerobic activities uses your heart and your lungs for a period of time. It also helps your heart use oxygen better and improve blood flow. You want to make your heart work a little harder every time, but not too hard. Start slowly. The patient should do aerobic activities such as walking. You should not walk too much, but do a little bit. Every day, there's a little drop of water makes the mighty ocean. Little, little, little. And you'll see improvement. Swimming, if you can, it's fine. Jogging, light jog, don't go to high intensity. Biking, we're talking about using the bicycle, cycling. Do this at least 3 to 4 times a week. You should not do much in a week. Always do 5 minutes of stretching or moving around to warm up your muscles and heart before exercising. Allow time to cool down after you exercise. Do the same activity but at a slower pace. Take rest period before getting too tired. If tired or have any heart symptoms, stop. Wear comfortable clothing for the exercise. During hot weather, exercise in the morning or evening, but be careful not to wear too many layers of clothing. All right, so guys, this is just a short video regarding CAD. If you're having any issues regarding CAD and you want to know more about CAD, I just covered the basics and I gave you my favorite part, which is exercise. Thank you for watching. Have a very nice day, guys. And one more thing before I go. When it's cold, patients should cover their nose and mouth when exercising outside. Resistance weight training may improve strength and help muscles work together better. This can make it easier to do daily activities. All right, thank you guys. Have a very nice day.